Thank you so much. I'm Theodora Scrotto. I'm a social worker. I'm here with the Environmental Health Trust, and I know that we have submitted probably over 250 pages of documents, including not just research, but also recommendations from medical organizations, because there are quite literally hundreds of doctors who are recommending precautions with this radiation, because there is enough to know that there could very likely be a problem. I mean, many doctors say that it really is conclusive. There are certainly doctors who say it's likely, but you know, having two children was how I got involved in this issue. And for my children, there's no reason to wait, because we cannot go back in time with kids. And I wanted to say it was raised about what resources to bring to parents and Environmental Health Trust, and I think I've given you all of these different documents. I know the state, the city of Greenbelt is actually handing out the cell phone radiation, how to reduce exposure to cell phone radiation. This is the Vienna Medical Association rules for mobile phones, and I'd just like to read to you what they say at the top. They say the radiation from mobile phones or smartphones is most likely not as safe as cell phone providers claim it to be. Therefore, the Vienna Medical Association has decided to do the responsible thing and inform the Austrian public about possible adverse effects from a medical perspective. And of course, they have the recommendation on using wires, not wireless, because although it's not, it's the same type of radiation, and as I've talked about before, it might not be directly to your brain, but it is going to your internal organs. And of course, our blood is circulating everywhere. Our femur is one of our largest bones. So, so this is incredibly important for my children and for all the children of the state. Also, I think I've shared with you the Baby Safe project, which is the chief of obstetrics at Yale gave a talk at the press conference for this program. I think signed by over 100 doctors now, recommending reduced exposure to pregnant women, and very specifically to reduce exposure to wireless as well as cell phones and devices at the abdomen. So I think that I thank you so much, and I think also wanted to say that by statute, this council, as I said before, I called you years ago because I would not get off the phone until I talked to anyone who could deal with this issue. I was on the phone probably for an hour before I got to Dr. Mitchell way back, because no one is actually is doing anything about this, and that is the task of this council, is to act to protect children, and the precautionary principle is the cornerstone of public health. So this just makes perfect sense. Thank you so much.